Welcome to Review Central. This is Nursing Licensure Exam Reviewer number 3. This reviewer is intended for those who are eyeing or are set to take the Nursing Licensure Exam, given by the Board of Nursing and administered by the Professional Regulation Commission of the Philippines. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous nursing licensure exams. Before we proceed, don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new review or other review materials on this channel. Now let's begin. Please refer to this situation for questions 1 to 5. Situation number 1. A 22-year-old male is brought to the emergency room with an apparent head injury after being involved in a serious motor vehicle accident. He is unconscious on arrival and exhibits signs of increasing intracranial pressure. He is accompanied by his fiancée and an adult friend. Question number 1. Which of the following positions would be most appropriate for a client with a head injury? A. Left Sims position. B. Trendelenburg's position. C. Head elevated on 2 pillows. D. Head of the bed elevated 30 to 45 degrees. The correct answer is D. The head of the bed should be elevated, ideally to 30 to 45 degrees. There are a couple of good reasons for elevating the head of the bed. First and most important is to decrease intracranial pressure. That's extremely important for the patient with a severe head injury. The other is to minimize bleeding. For this purpose, the reverse Trendelenburg or the Fowler's position will be appropriate. Elevating the head with pillows is inappropriate as it may cause undue strain, and possibly even injury, to the neck and spinal column. With the Trendelenburg position, the head of the bed is reclined downward, so it is not appropriate for patients with head injury. The Sims position is also not appropriate as it is meant for patients with back injuries, or for examining the back part of a patient's body. Question number 2. Which of the following respiratory signs would indicate increasing intracranial pressure of brain stem? A. Nasal flaring. B. Slow or regular respiration. C. Rapid, shallow respiration. D. Asymmetrical chest excursion. The correct answer is B. Slow or regular respiration. Increased intracranial pressure, ICP, is a rise in pressure around the brain, resulting from an increase in the amount of fluid surrounding the brain due to an injury. It can also mean that the brain tissue itself is swelling. Increased ICP can be the result of a brain injury, and it can also cause a brain injury. Increased ICP is a life-threatening condition. A person showing symptoms of increased ICP should be given emergency medical treatment right away. Cushing's triad is a term used to describe 3 symptoms that happen together and usually signal increased intracranial pressure that requires immediate care. These symptoms include irregular breathing patterns, an increasing gap between systolic and diastolic blood pressures, and a drop in heart rate. Question number 3. The client's initial BP is 120/80 mm of mercury. As his condition worsens, pulse pressure increases. Which of the following BP readings indicates a pulse pressure greater than the initial pulse pressure? A. 102/60 mm of mercury. B. 110/90 mm of mercury. C. 140/100 mm of mercury. D. 160/100 mm of mercury. The correct answer is D. 160/100 mm of mercury. The systolic blood pressure, the numerator in a BP reading, is the maximum pressure that the heart applies when beating. The diastolic blood pressure, the denominator in a BP reading, is a measurement of the pressure in the arteries between heartbeats. Pulse pressure is the difference between the systolic and diastolic blood pressure. In the given question, the initial BP is 120/80. Therefore, the pulse pressure is 120 minus 80, which is 40. Among the answer choices, only a BP of 160/100 will result to a pulse pressure that is higher than 40. Question number 4. The client receives mannitol during surgery to help decrease intracranial pressure. Which of the following nursing observations would most likely indicate that the drug is having the desired effect? A. Pulse rate decreases. B. Urine output increases. C. Blood pressure decreases. D. Muscular relaxation increases. The correct answer is B. Urine output increases. A diuretic, mannitol causes the cells in the brain to dehydrate mildly. The water inside the brain cells leaves the cells and enters the bloodstream as the mannitol draws it out of the cells, into the bloodstream, and eventually ends up as urine. Question number 5. When the client is fully conscious, the nurse would best assess his motor strength by having him: A. Squeeze the nurse's hand. B. Demonstrate his ability to move his legs. C. Signal as soon as he can feel pressure applied to the soles. D. Feed himself with a spoon. The correct answer is A. Squeeze the nurse's hands. Normally, assessing motor strength includes comparing bilateral hand grasps, upper extremity strength, and lower extremity strength. In the case of trauma patients, like victims of serious vehicular accidents, bilateral hand grasps would suffice. The nurse does this by extending 2 fingers on both hands toward the patient, and asking the patient to squeeze both hands to compare for similar bilateral strength. Please refer to this situation for questions 6 to 10. Situation number 2. An understanding of the factors influencing the healthcare delivery system will enable nurses to adjust to change, create better ways of providing nursing care, and develop new nursing roles. Question number 6. With regards to illness prevention activities as part of nursing care, which of the following will help clients most? A. Manage stress. B. Reduce risk factor. C. Maintain maximum body function. D. Promote habits related to healthcare. The correct answer is B. Reduce risk factors. Reducing risk factors is the most helpful illness prevention activity for clients. Reducing risk factors is essentially preventing the onset of illness, so it is a proactive rather than a reactive measure. It falls under both primordial and primary prevention activities. Question number 7. Which of the following healthcare agencies is usually family-centered, relatively recent in popularity, and oftentimes focused on maintenance of comfort and satisfactory lifestyle of clients in the terminal phase of illness? A. Hospice. B. Support group. C. Community health center. D. Non-government organization. The correct answer is A. Hospice. Hospice care focuses on the care, comfort, and quality of life of a person with a serious illness who is approaching the end of life. Hospice care places a high value on dignity, respect, and the wishes of the person who is ill. It aims to look after their medical, emotional, social, practical, psychological, and spiritual needs, and the needs of the person's family and carers. Looking after all these aspects is often referred to as holistic care. Most hospice care is provided at home, but it can also be provided in a care home, as an inpatient at the hospice itself, or as a day patient visiting the hospice. In the Philippines, at least 30 organizations provide hospice and palliative care services. Question number 8. Which of the following is not a legally binding document but nonetheless very important in the care of all patients in any setting? A. Bill of Rights as provided in the Philippine Constitution. B. Scope of nursing practice as defined in RA 7164. C. Board of Nursing resolution adopting the Code of Ethics. D. Patient's Bill of Rights. The correct answer is A. The Bill of Rights as provided in the Philippine Constitution is not a legally binding document but nonetheless very important in the care of all patients in any setting. The Bill of Rights as provided in the Philippine Constitution is a general declaration of the rights enjoyed by every Filipino citizen. It is a very important document unto itself. Being enshrined in the Constitution, it is part of the laws of the land and is, strictly speaking, a legal document. However, insofar as patients' rights are concerned, it has little to no direct impact and practical application, as it does not contain any provisions specific to the concerns and issues relating to the care of patients. In contrast, the Patient's Bill of Rights is a compilation of laws giving very specific rights and protections to patients, including, but not limited to, right to appropriate medical care and humane treatment, right to informed consent, right to privacy and confidentiality, right to information, the right to choose healthcare provider and facility, and so on. RA 7164, on the other hand, is the law that regulates the practice of nursing in the Philippines and, therefore, has a direct impact in the care of patients. All registered nurses in the Philippines are bound by profession to uphold the Nursing Code of Ethics. As such, it is a very important and legally binding document in relation to the care of patients. A nurse who violates the Nursing Code of Ethics may lose her or his license to practice the nursing profession. Question number 9. By experience, which of the following are the most common services overlooked by nurses and other members of the hospital team in the care of their clients? A. Diagnosis and treatment. B. Rehabilitation of patients. C. Illness prevention. D. Health promotion. The correct answer is D. Health promotion. Health promotion is one of the key nursing services. However, by experience, particularly in the Philippines, it is most overlooked and given least priority and focus. It is ironic because health promotion is a key activity in reducing risk factors, which helps patients the most, as it is a preventive rather than reactive approach. But why is health promotion not given the priority and attention it deserves? There are a myriad of reasons, including bureaucratic inertia, cultural biases, economic realities in the healthcare industry, and so on, but the biggest single factor is the seemingly perpetual inadequate staffing in the nursing and other healthcare professions. Aside from suffering from physical and emotional exhaustion, nurses and other healthcare workers are forced to focus on reactive, such as diagnosis and treatment, rehabilitation, etc., rather than proactive, such as health promotion and illness prevention, healthcare services. Question number 10. Wellness clinics and health education activities have been integrated in government hospitals and tender appropriate services. Which of the following purposes least help clients in cases of these health promotion activities? A. Maintain maximum functions. B. Reduce the costs of health care. C. Identify disease symptoms. D. Promote health habits. The correct answer is C. From among the answer choices, identifying disease symptoms helps clients the least. Among the given answer choices, identifying disease symptoms is least helpful since it has little tangible benefit and practical value for clients. Maintaining maximum functions offers tangible benefits to clients as it leads to a healthy and more productive lifestyle. Promoting healthy habits reduces risk factors and prevents the onset of illnesses, which ultimately results to the reduction in the cost of health care. Aside from its informational value, identifying disease symptoms is a reactive rather than proactive activity, since its usefulness comes only when the client already contracted, or is suspected to have already contracted, a disease. You have just completed Nursing Licensure Exam Reviewer number 3. If you wish to watch more Nursing Licensure Exam Reviewers, check out our Nursing Reviewers playlist. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming nursing licensure exam, and we look forward to your fulfilling career and professional life as a registered nurse in the Philippines. Good luck and God bless.